there's a big disparity in the health of our fellow citizens depending on their race, their economic status, and the place of where they live.
We have to pay attention to the quality of neighborhoods, the quality of our surrounding, that in fact where we go to school, where we live, our neighbors make a difference in the quality of our health and our life.
That difference in life expectancy is really significant. It's not just 5 days or 5 weeks, but it's 5 years, 7 years, 8 years for groups here in the Twin Cities.
Knowledge is coming from the people, from their culture, from their ways of knowing, and that's the knowledge that I think will give a different set of solutions going forward.
What's really important about this is it establishes once and for all that inequality is a life and death problem.
Health outcomes and economics are related. And in some ways that might make it seem a more complicated problem to solve, but to me that means if we make progress in one area, we make progress in them both.
Now it's just we got to continue to roll up our sleeves and put our best foot forward.
Unequal Distribution of Health is a co-production of the Blue Cross and Blue Shield of Minnesota Foundation, online at bcbsmnfoundation.org and TPT's Minnesota channel.
Two words are emerging in the quest for better health in Minnesota: health inequities. Powerful words that reveal an eye-opening story. More than half of a person's health is driven by social factors, not just access to care or genetics as some may assume. These factors include income, education, race, and neighborhood. The Blue Cross and Blue Shield of Minnesota Foundation commissioned Wilder Research to ask the important question: is there a connection between socioeconomic status and health in the Twin Cities as there is in other areas of the country? This program presents the answers to that question and includes reactions and solutions from community leaders. It was taped on October 7th, 2010 in St. Paul, Minnesota.
Our topic today is health inequities, and in opening the discussion, I'd want to ask, is this something that is typical of our local region, or is our region immune to some of the inequities which we can see at the national level?
Compass does this research because we want to see good data provided to people to inspire action and to make certain that whatever planning occurs for developing policy, developing programs, developing communities, that it happens with a good sound base of information.
If I were to ask you at some point, well, now or earlier in your life, gee, at the end of your life you could add on another 5 days, or maybe another 5 weeks, you might say, well, I don't know, that's not that much. But what if I said 5 months? You might start to think, gee, there's a lot I could do in 5 months. And what if I said 5 years? You would think, yeah, that's something I would really want to work on. That really does matter.
Well, in the case of health disparities particularly, there are several things we want to do. Number one, we want to provide a really sound platform of information. Number two, we hope to actually inspire groups to take action in their communities, to see that these health disparities are something to be concerned about. And then third, we'd like to work with interested organizations, individuals who actually want to do something to promote change.
For the past 5 years, the Blue Cross Foundation has been working in the area of social determinants of health and focusing really on upstream factors. And these are the things that determine your health within your own communities. So we're looking at things like early childhood development. Are the kids ready for kindergarten? We're looking at the housing. Are the kids living in healthy housing, safe housing? Is it free of mold? Is it free of lead? And then we're also looking at environmental toxins, because we think that these conditions exist in a lot of the communities today, and some in our own homes. We all need to be aware of these things. 100% of your health is really determined by 3 main factors. So 20% is determined by whether or not you have access to health care. 30% of your health is determined by your own healthy or unhealthy behaviors. And then the third component is the other 50% of your health is determined by other factors. Things such as, did you go to college? Do you have a well-paying job? Do you live in a safe home free of environmental toxins, lead and mold? Is your neighborhood safe? Do you have a grocery store within walking distance? And we can go on and on and on. I'd like to now introduce Craig Helmstetter, Wilder Research Consulting Scientist, to provide the results of the report. Craig?
I have the honor today of presenting the results of the study that we are releasing, the Unequal Distribution of Health in the Twin Cities, commissioned by the Blue Cross and Blue Shield of Minnesota Foundation.
Well, I think the key findings that we took away from doing the study were that, one, that race and ethnicity matters when it comes to health in the Twin Cities. Another one is that income matters when it comes to health in the Twin Cities, and that includes both the income of yourself as well as your neighbors. Education matters, place matters when it comes to health in the Twin Cities, and since all of those things matter, then it just goes to reason that policy also matters when it comes to health in the Twin Cities.
I think one really important finding of this report is that health outcomes and economics are related. And in some ways that might make it seem a more complicated problem to solve, but to me that means if we make progress in one area, we make progress in them both.
I keep my head up when I see some of these numbers. While it's a sobering reality, it's a sobering story that was told by this report, at the same time, I've got to couple it with what I know is also happening in Indian country, in Minneapolis, St. Paul, and I can hold my head up knowing that we're heading in the right direction.
I think the results probably not shock anyone, but what's really important about this is it establishes once and for all that inequality is a life and death problem.
With this project, the main question, as has already been introduced, is whether or not health inequities exist here in the Twin Cities. We've already seen a bit of an answer to that question, but the follow-up to that question is, if these health inequities do exist, what do they look like here? So here's our first look at life expectancies that we calculated in this study. You can see here that overall in the Twin Cities we have a fairly high life expectancy with 80.6 years, but you can also see some pretty startling discrepancies here. If you take a look at the American Indian group, 61.5 years is the life expectancy for that group. African Americans, 74.4. Contrast that with the white group and the Asian group with 81 years and 83 years respectively. So some big differences even beyond the 5 years that Paul was citing earlier, over 20 years in the case of the American Indian group. So some big and startling, disturbing differences.
The report really talked about this issue of social determinants, things like where you live, your educational attainment, your wage, your income, and how much effect that has really on your quality of life or your health. And in fact, it's been some interesting revelation in some sense that says where you live matters. The level of education matters to your health, and the fact that income matters. And so it was an interesting report that just spoke to things that in essence we know, but really gave in essence some science to the reality.
What the results tell us is that there are wide disparities between different communities within the Twin Cities, and those disparities kind of point to a series of different things that are drivers to those different kinds of results. Things like education, housing, community, race, all of those things are really factors when we look at the mortality or morbidity in the Twin Cities.
Some of the key findings coming out of our analysis, I'm going to start to scratch the surface on the final question about addressing health inequities in the Twin Cities and what might work. Of course, the panel will be digging into this quite a bit deeper, but just the fact that we do find health inequities here in the Twin Cities made us want to reference other studies that where people have really dug in and looked at recommendations on how you deal with these sorts of things. But one of the problems with existing research and the studies that have been done elsewhere is that they either come up with very broad recommendations. Obviously, social determinants cover a lot of ground, so you get very broad recommendations like improve daily living conditions, tackle the inequitable distribution of power, money, and resources. Important, but kind of hard to get your hands around. This third one I'll mention is something that a researcher can start to sink his teeth into, measure and understand the problem and assess the impact of action, but still pretty broad. So that's one end of the spectrum. Other studies that exist really get into the weeds. Obviously, you can't read this. It's not a bad list, and we do include it in the report, but the point is there are a lot of different things that you can do, and so I'm hoping and trusting that the panel will get us to narrow in on a few key things that are important here in the Twin Cities.
What was really important is that Blue Cross Blue Shield is releasing this study, asking for us in the community to think about what are we doing within our communities, within our organizations, within our lives. What are we doing that we could also share with you today so that this is not doom and gloom? It's said that a time for the discussion about life expectancy, how life is lived among African Americans, how that happens, it's said that it's time for us to have that dialogue, that discussion in public.
It's something where, again, when I read it, it wasn't nothing new. And as I sit up here, I feel a certain heavy heart with it. Just knowing what it represents in terms of the struggle of my people and the result of the collision that occurred hundreds of years ago. In the 1950s, the life expectancy for American Indian adult was 45 years. And at a time when just 300 years ago, there was a conservative estimate of over 7 million American Indians just here in the United States, and by the early 1920s, less than 200,000. So I understand these numbers, and it's important, I think, to understand it in a much broader context. What this study shows is that we have to pay attention to the quality of neighborhoods, the quality of our surrounding, that in fact, where we go to school, where we live, our neighbors make a difference in the quality of our health and our life. But the story doesn't stop there. I mentioned there's a renaissance, a resurgence, a return. And so while I can say, yeah, the average age now is 61 point something according to the study, that's a huge improvement from the 1950s. And that huge improvement is a result of Indian folks reclaiming, in essence, their communities through efforts of language revitalization, cultural revitalization, economic development. We're using these tools to craft a promising future. So I keep my head up when I see some of these numbers. While it's a sobering reality, it's a sobering story that was told by this report, at the same time, I've got to couple it with what I know is also happening in Indian country, in Minneapolis, St. Paul. We've got to really move upstream and against stream in terms of traditional methodology that you often see in our communities. And I'd lastly would say that you've got to value the Indian community. You've got to see the Indian community in terms of being an asset. And I say that sincerely. I think often we think of Indian community, whether it's reservation communities, others, as a liability, as a bump in the road, as opposed to really something that we want to embrace, include, and preserve.
I'm going to describe the policy as in the simple word alignment or integration of effort between different sectors. And to me, it's particularly in this time of grave national concern about budget deficits, both nationally and the state government. How are we going to meet all of our public and community needs within our means without running up an enormous debt or taxes that can't be supported politically? All of the different sectors, affordable housing, jobs, environment, public and private sector, health, need to be more and more aware of the impact or the effect of what they do on these other sectors. So if you have, for example, invested $1 of public investment or philanthropic investment, in our case, in the preservation or development of affordable housing, well, you get a big return just from creating that housing in terms of addressing this income disparity. But if you do it also in a way that saves energy, reduces carbon footprint, and promotes good health by careful design and best building practice, then you've achieved more benefit for that taxpayer or philanthropic dollar. And imagine if that became a more conscious, intentional policy throughout all of our community endeavors. The benefit to the low-income families is greater because they not only have housing they can afford, but they have better access to job opportunities, which again reduces that disparity, gives them improved health, and again, if we do our design and construction, we can get an even bigger payoff.
One of my other props up here is a piece that we're putting out, and you can get this in the lobby, on community health workers. This is a great opportunity, and I think it speaks to some of the things that Justin was touching on about having people in the community be very much leading the solutions. We don't come from a place where we believe we have all the ideas. We think the ideas are out there. We think the important thing is that ideas, creativity, initiative does not happen in isolation, that we leverage those assets and resources that we have. And so we need to think as a community. We need public policy that supports community health workers. We need communities that support community health workers. We need insurers that see that as a value and something that we should invest in. And so that's one idea.
And I would suggest beginning with research, how it's done. The communities can come forward and say, this is, longevity is an issue for us. So we want to study how do we live longer based on some of the people in our community who are 95 and so. What did they do? So developing research methodology that incorporates the language and concepts within the cultural groups, and then having the capacity building strategies to support those communities documenting that themselves. The work that we did that came up with the theory of sickness that is individualism, loss of culture, and loss of community is what makes you sick. So how do you turn that around? You develop a philosophy of community, not a geographic community or an ethnic or racial community, but a community that inspires, uplifts, having babies in a circle. So you have mothers who have had babies teach other mothers. So the birthing team ideas support that. Very consistent with the community health workers. Elder coaching, support that. Very consistent to this idea of non-professional experts giving guidance to those who are in the field and think they're experts.
Individuals make decisions, but they don't make them in isolation. They make decisions influenced by marketing, by their cultural context, and maybe most importantly, by the policies that set the conditions for those decisions. You can't make decisions to be healthy if everything in your environment's steering you to make unhealthy decisions. So we need to look critically at putting new policies in place that incentivize people to make the best decisions possible. We don't have those right now.
I think there's policy choices we can make in a number of different areas that can make a difference here. First of all, there are investments the state makes that ensures that today's kids will reach their fullest potential in education and employment. Those include investments in affordable early childhood education. When we make those investments, not only are we making an investment that really pays off in those kids' school success and economic future, but it makes sure that their parents today can be fully participating in the workforce, knowing that their kids are in a safe and enriching environment. We also know that when we invest in affordable housing and provide a stable living place for kids, they do better in school. And doing better in school tends to mean doing better in employment in later life. Another area to look at is there's some state choices that ensure that we have more quality jobs. So that can mean increasing the minimum wage, so people who work full-time can make ends meet. It can mean making sure that more people have access to paid sick days. So staying home when you're sick or taking care of a sick child does not result in loss of income or even loss of a job. And then finally, when we look at the investments that we're making for health outcomes, that might mean creating a new clinic in a community that needs it, making sure there's a rec center available so people can get exercise, or maybe creating a farmer's market so people have access to fresh fruits and vegetables. Those also have job components to it. How can we make sure that low-income people, people of color in those communities have access to the jobs, both constructing those facilities and good jobs working in those facilities? So we're making progress on both the health and income front at the same time.
You know, you can admire the problem forever, but at some point as a citizen you do have to do something about it. And there are lots of things people can do individually. This is the land of 10,000 exemplary nonprofit organizations. A lot of them are tackling this in a lot of ways. Groups such as Admission Possible, Parents United for Public Schools, Ready for K, and some of the education groups that are built around attainment and achievement of minority groups. The Minnesota Minority Education Partnership has a covenant that folks can sign up for. You can be mentors to children and youth. There really is, it is astonishingly easy to find something to do as a citizen. Beyond that, though, you have to think globally, and you have to think community-wide, and you have to think about these public investments and the good that government does and the good that it can do. And you need to be supportive of public sector role in improving this situation. The nonprofits themselves will tell you they cannot do it alone, and that the charities simply do not have the resources to address this inequality problem.
Right now, the majority of American Indian people live off reservation, and they live primarily in urban areas, and this is true throughout the country. But much of our federal policies, which I understand, are between the federal government and tribal nations, and hence goes also the funding. There's limited funding, and that limited funding is articulated and granted primarily through the federal government to tribal nations. Much of those dollars actually do not come into the urban environment where the majority of Indian people are. So in many ways, tribal members are not beneficiaries of that. So I would say one of the policy issues that we've got to think about is not to cut into the tribal pie. I got to be clear about that. My issue is not to cut into the tribal pie, but that in fact we've got to think about funding and policies that specifically address urban American Indian folks who live in metro areas throughout the country. And in fact, how is the federal government responsible in sort of that trust relationship again with the members of these nations, even not just sort of land-based reservations. So that's a very complicated issue, but it's one that I think we've got to continue to look at and create some sort of equitable distribution of dollars that go to Indian people that actually ends up in Indian hands, particularly in urban areas.
We're at a point of crisis, I think. We are investing so much of our national income and wealth in health, and yet we still have these disparities. We're not getting the return on investments that we need, and I think that's not a question of people not having goodwill or wanting to do the right thing, but maybe a question of perspective. And what this report says is that if we reorient ourselves to look at building better communities, better environments in those communities, and addressing many of these social determinants at the same time, we could do a better job.
Our Twin Cities region is an interconnected economic engine, and the areas that right now are doing better are not going to continue to do better if so many other residents are being left behind economically and don't have access to the educational opportunities they need and access to quality jobs to make sure that our region as a whole is really prosperous.
Unequal Distribution of Health is a co-production of the Blue Cross and Blue Shield of Minnesota Foundation, online at bcbsmnfoundation.org and TPT's Minnesota channel.